series to promote public awareness on current issues on food security and sustainability, water and development, social policy and institutions, and local governance for several years. And to continue fulfilling our mandate, we shifted to the webinar series, which we are very much excited for two reasons. One is we can now be seen and heard beyond the neighboring towns and neighboring provinces, our regular Suki or participants to our seminar series. Two, the webinar series will feature multi-awarded mayors of cities and municipalities. And this is your moderator for this webinar series, Merlin Paunlagi. Before I say more, let me turn you over to the Dean of the College of Public Affairs, who has been also very busy providing assistance in any way possible to our local and international students stranded at UPLB. Our very supportive Dean, Prof. Rolando T. Bello.
Magandang hapon po sa inyong lahat. Dito pong ating webinar ay ginawa po natin para po sa ating mga tagapakinig ngayong hapon na ito. At simulan ko lang po yung opening remarks. This inaugural webinar is our launchpad to a series of webinars highlighting the strategies employed by the local government units in managing the impact of the COVID-19 pandemic. While most, if not all, of the local government units were taken by surprise and largely overwhelmed, many took up the challenges and rose to the occasion to provide the safety nets to individuals and households, mobilize public and private resources, and forestall the overburdening of our tenuous health systems during the community quarantine. The chief local executives down to the members of the community brigades were our parallel frontliners who assumed enormous risks, endured numerous sacrifices while nurturing our needs despite the intermittent disorderly conduct and delinquency and the already overextended fiscal resources. Today, we have invited two exceptional and remarkable local executives, and they are Honorable Mayor Arlene B. Arcillas of Rosa City, Laguna, and Honorable Mayor Rex D. Gatchalian of Valenzuela City in the National Capital Region. The conveying of their invaluable experiences, best practices, and lessons learned during these past 3 months will serve as a veritable yardstick to other local government units in the response to future pandemics and disasters. We are truly grateful for their participation as well as our registered participants in Zoom and other media platforms who have indicated their interest to learn and contribute to nation building. We hope to have you in our ensuing webinars as we endeavor to pursue our public service mandate in these trying times, and together with our partnership with the CPAP Alumni Association, headed by our alumni, Mr. Paulo Velasco. Thank you.
Thank you very much, Dean, for sharing more information about this webinar series and about the pandemic. Let me just reiterate that we are also available at FB Live. Now I move on to the main event of the webinar series. I'd like to introduce you first, the first speaker. Our speaker has proven herself as an outstanding government and elected official. She became Kabataang Barangay Federation President of then town of Santa Rosa in 1984. Elected senior councilor in 2004, elevated to city vice mayor in 2005, and assumed as OIC mayor in 2006. In 2007, she was elected as the first lady mayor and the first elected city mayor of the city of Santa Rosa. She served for 3 consecutive terms. Proof of her effective service, she received the Presidential Lingkod Bayan Award in 2011. It is the highest award given in the country through the Civil Service Commission and the Office of the President of the Republic. In the 2016 elections, she was elected as the representative of the 1st District of Laguna. She ran unrivaled, adding to her already impressive record in public service. Her commitment to serve is not limited to her constituents. The House measures she anchored and those that she helped examine benefit the whole country include Republic Act 11036 or the Philippine Mental Health Law, Republic Act 10931 or the Universal Access to Quality Tertiary Education Act, National Policy on Ease of Doing Business or Republic Act 11032, Republic Act 11223, also known as the Universal Health Care Act, and Republic Act 11292 or the Seal of Good Local Governance Act of 2019. These are the very laws that we really need during this pandemic. And now she's back in her first home with a fresh mandate after having won the 2019 elections to serve once again as the city of mayor of this progressive city. Truly, she is a woman committed to public service and will continue to make extraordinary contributions as the mother and leader of her beloved city, especially during this time of pandemic. Ladies and gentlemen, it is my honor to introduce to you the city mayor of the city of Santa Rosa, Laguna, Arlene B. Arcillas.
Yes.
Good afternoon, Mayor.
Yes, ma'am. Good afternoon to everyone. Of course, Director Merlin, thank you for the introduction. To Dean Roland Bello, to all other participants of this webinar, and of course, to my colleague and a very good friend, Mayor Rex Gatchalian of Valenzuela. We were together last time in Senate regarding the interim terminal. But anyway, again, hope all is well, and I'm very happy to be invited in this webinar to show how the best way we can manage the impacts of the COVID-19 pandemic. In my introduction, it was mentioned that I've been serving as a public servant since 1984. And in my introduction as well, I was mayor when I was councilor when SARS, I think SARS in 2004 was experienced by the Philippines, and then in 2009 H1N1. I was mayor then in 2015. The worst of I've experienced it as well in 2015 as mayor, and now I'm experiencing being the chief executive COVID-19, not only affecting our city, not only affecting our country, but the whole of the Philippines, which makes it a problem na masasabi natin no one can help us, ourselves lang, and no one can help us in our city. Kasi unlike any other calamity like flooding, very localized, diba? So the other neighboring cities, the national government can help us. But this time, I think we're on our own. That is why the city of Santa Rosa, I think, is managing. What we promoted is managing the pandemic on personal programs, you know. I've already pushed, and I've been pushing for participatory governance in the city of Santa Rosa, and managing this pandemic as well. I think is how we manage it is through participatory governance. By of course first identifying key people in the city of Santa Rosa to manage the pandemic with me, the chief executive, the barangays. Very important. Other private institutions are very important who are here in the city of Santa Rosa, but most of all, the people, our constituents themselves, I ask them to help us. Why? Because we are all affected. And I know that if we all understand well this pandemic, then we can help each other. Yun po yung pinromote ko that for the people, first of all, to understand COVID-19. And I'm very happy with the way that we are addressing this. They've accepted that we are affected. They've accepted that I need their help to combat this COVID-19. As well as the HOA, kapag kami nagpa-positive sa isang area, most of the people, ang reaction is kung pwede lang hindi home quarantine. We're doing home quarantine, we're doing hospitalization. But then again, pag home quarantine, pinapa-accept ko sa community, which is very important, dun sa village, for example, kung paano kami tutulungan. And what I did was, what we are doing here is ginagawa namin na ma-accept nila and binibigyan namin sila responsibility to take care as well, no, of that patient. How? Of course, not by going there, but physically taking care of them, but for us making them our monitoring team in their particular areas. But anyway, again, so I mentioned a while ago that no one can help us. It is us in the city who can help ourselves. With regards to this, we of course we follow the guidelines of IATF, but then again, it is up to us how we combat it. And again, participatory governance was very crucial. So first, what we did was identify the immediate problems. When ECQ was declared, there were challenges and there were problems that we had to address. First of all, ECQ, we made the people stay in their homes. So ano pangangailangan nila? Very important, of course, is our food aid. So here we will show all the management, how we manage the pandemic, food aid to all families, financial assistance to affected sectors, and most of the sectors were affected, transportation for frontliners, health workers, and essential workers, enforcement of guidelines, disinfection, of course, it's very basic, facilities to respond to COVID-19 testing, and then the donations. So all throughout, simultaneous po yung pagbibigay namin ito. But first of all, very crucial, as chief executive, paano ka makakapagbigay ng food aid to families, paano ka makakapagbigay ng financial assistance. Very important for us, and for our finance team, is to check the capacity of the city government. Doon mo makikita kung gaano ang ibibigay mo, kung how long you can give. So of course, first we had to check the budget of the city, and we had to prioritize budgeting. So prioritization ang nangyari po. We reviewed again, parang nagba-budget ka ulit. We reviewed again what we can use to help the people, to help the city of Santa Rosa, to help our residents, our households and families. So we revised the budget. We were given guidelines naman, no, by the national government, CBM, the LG, how to use our budget. Luckily, the city of Santa Rosa, I medyo swerte po because we have continuing programs na pwedeng hindi muna ituloy. So again, sabi ko nga, budget prioritization and prioritization ng kailangan ng gastusan. And the priority now with the pandemic is, of course, how we can help the people na magkaroon ng pagkain, na magkaroon ng konting panggastos sa essentials nila. And of course, makikita natin yon kung paano natin sila matutulungan. So again, budget prioritization, we had to do away muna, no? We realigned budget from the continuing. As of now, I haven't even used our savings yet. Again, sabi ko medyo maganda yung pag-handle natin last year ng ating finances. Kaya we're very lucky na we haven't resorted yet to the 20% na 20% namin na pwedeng gastusin. Of course, inuna natin yung sa ating disaster. No? We change kung paano namin gagawin. And then again, sabi ko nga po, yung sa continuing namin muna yung ginamit. And with that, we can see how much we can use as of this moment. Ang ano naman doon is, at least after this, yung pwede namin gamitin initially, ay after, kasi alam natin, hindi to natatapos pa ngayon. So, meron pa kaming nakaset for the next wave, kumbaga. Ano? That's why up to now, we're still distributing food aid, we're still distributing na mas makaka-compensate sa haba nung affected days ng mga tao. So, again, we will show you yung ginawa namin, food aid for the people. Of course, we planned how many households, how many families, we give each family 200,000 po yung nako-cover namin na pamilya. This is from the, kung masasabi natin, from the first of the poor na family to those na nakatira sa villages, yung alam natin na medyo nakakaangat. Why are we giving them as well? Because sabi ko nga, we ask everyone to stay at home. That is our first directive. So lahat sila affected. So we cannot choose now. Sino yung bibigyan? Bakit natin bibigyan yung mayayaman? Bakit? Dahil not even because they're paying their taxes, but because alam natin na pinastay natin sila at home. So everybody is considered affected. Kaya kasama rin sila sa binibigyan natin ng tulong. So if you may review our PowerPoint, we have food aid. We have food aid for our all families. Kung may sa isang household, may dalawang pamilya, tatlo, may food aid sila. First up to the fourth wave. We're doing the fourth wave now. Yeah, we gave healthy food packs. One of the strategies also in order to as well help those industries na bukas tulad po ng ating mga farmers, mga agricultural products ay kinuhaan natin sila even if they're not from Santa Rosa. One observation na nakita ko na gagawa namin ng solusyon after this pandemic is hindi self-sustaining ang syudad in terms of fresh food, hindi self-sustaining. So we have to develop that. We have to go back to the basics. Ito yung testing ko. So we distributed food packs. So every wave po ay dumadagdag siya. Nadadagdagan kung ano yung binibigay namin. Bakit? Because nakikita na namin, no, how much we can spend for food. And alam na rin namin na especially now, they're asking me bakit kung kailangan logistic we nag-distribute pa rin kami. Bakit? Dahil ngayon po natin nalaman after June 15, doon pa rin dumadagdag kung sino-sino yung nawawalan din ng trabaho. So it doesn't stop doon sa category na nililay down sa amin. But alam natin once we open up, doon pa rin natin malalaman kung gaano karami yung affected na mawawala ng trabaho. That's why we continue on with the food distribution as well as yung financial aid po namin na for economic stimulus package na financial ay ngayon pa lang namin ibigay para yun doon sa mga nawala ng trabaho. But then again, I also assisted the barangays in terms of financial assistance for them to be able to add doon po sa ibibigay nila sa kanilang mga kabarangay on top of what the city is giving as well. So those are the food, the vegetables. Nag-include din po tayo ng fresh vegetables sa ating mga food packs. And then to sustain them as well, our City Agriculture Office ay namimigay din po ng seeds para po maitan ng ating mga kababayan, which again, pinopromote natin sa lungsod ng Santa Rosa because you know that ang Santa Rosa po is highly industrialized and commercialized. So again, na-realize natin we have to go back to the basic and most of all, ang unahin po natin ay ating agricultural sector. And of course, may hindi nakakalabas po. We opened up our palengke, of course, with the corresponding protocols. But then again, marami din po because we asked them to stay at home. We did the rolling palengke by schedule po siya. And then the financial assistance, sectoral po yung ginawa natin for the financial assistance na naiintindihan po naman ng mga tao na hindi bawat pamilya meron. These are, yung alam natin affected, are vulnerable sectors. Ito po yung nabigyan natin ng mga assistance. Even the private school teachers we gave dahil nawalan sila ng sweldo from the last SEM. And then assistance to senior citizens, tuloy po yan, even up to now. For our PWDs, we have as well. Tricycle drivers, na alam natin nawalan ng pagkakakitaan. And the jeepney drivers, we also gave. And on top of what we gave as what assistance we gave to the jeepney drivers personally, individually, ay sila rin po yung kinuha natin when nag-close down po yung transportation because hindi pa na-push through yung modernization sa Santa Rosa. Yung maaayos na jeep natin ay ating pong kinuha to serve as our emergency vehicles. First of all, dapat for medical health workers lang. But then, may inaalaw tayo mga tao na lumalabas. So, sila na yung emergency free vehicles for our constituents na lumalabas. And then, we give vans naman for our medical health workers, yung mga papasok po. So, what we did was, para hindi malalapit or nagkakakumpul-kumpulan yung mga tao, may mga points po tayong nilagay para po doon pupunta or doon sila i-pick up. And then, of course, with corresponding health protocols na sinasagawa. Yes, of course, again, sabi ko nga, participatory governance, very important po ang role ng ating sangguniang panlungsod. Of course, there are ordinances and executive orders that we ask them to pass for control as well. And very strict po, naging very strict na lungsod ng Santa Rosa with regards people coming in and out of the city. Why? Because we assess kung sino po yung mga nagpa-positive sa atin. And during my assessment, together with our medical team and even with private hospitals, yung nagpa-positive po natin ay kalimitan ay galing from the infections coming from, I'm so sorry not, with respect to the other cities from other areas. Bakit? Kasi in one family or in one area na may nag-positive po, kalimitan that person ay hindi po talaga active in the community. No? But ang kanyang contact lamang ay yung workplace niya, outside, or napansin namin yung family niya na not from Santa Rosa. So we're very strict on travel passes. We did online travel pass. No? Doon po isasabit yung mga requirements, and then para pagdating po dito ay kukunin lang ang travel pass. So of course, the ordinances that we implemented during the quarantine. Yes, also with regards the travel pass, we're very strict on it. Kalimitan pa ngayon kasi kailangan may PNP clearance as well. So, parang ginawa namin siyang one-stop shop na isa na yung pupunta ng tao, hindi na kailangan mag-lipat-lipat pa. Even our medical health certificate, pero one-stop shop na lang lumalabas. And of course, I always say na half lang po yung socio-economic na problema, kung ano ba kainin ng tao, kung anong magagastos ng tao. Half of this is the health care system natin. This is a health emergency. So simultaneous with what we're giving to our constituents, to our households, to our families in terms of ayuda, food, and financial, simultaneous to that is ever since the start, we've been planning how to take care of these people health-wise, how to make the positive ones recover. At crucial po dyan ay aming participation and aming cooperation, coordination, as well as yung programa namin. Kasama po ang ating mga health workers natin, kasama ang ating mga government hospitals, and even our private hospitals. So, last April, we together with the Medical City South Luzon, we opened up the first quarantine facility there, yung tent po natin, and city government po nag-donate ng mga beds doon. And then we have the Santa Rosa Community Isolation Unit. And another thing, this is just another example of PPP. Kumbaga, nag-participate po ang lahat dito. Hindi ko po ginamit ang ating mga public schools and universities para gawing isolation. Bakit? First of all, baka magka-stigma later on pag inupan natin. Pangalawa po, most of our public schools are in the middle of the barangays or community, which I think is not very ideal. So ang ginawa po natin, naghanap tayo ng isang building that we can use, no, para po i-develop into our own isolation unit. And we found this old school po ng Inalibad High School, which is not in the middle of a barangay, but isolated. At ito po ay hiniram natin, no? And to be leased sa Diocese of San Pablo. And they were very happy dahil magagamit natin. So, ang building po is owned by the Diocese. Foundation po ng Inalibad, kasama po ang isang group of builders. We renovated the school building. And then the city government, yung pong mga medical equipments ay part po ng city government. So from an old school building, ito na po yung nagawa natin na isolation, which is being used now not only by the residents of Santa Rosa, kundi pa pati po yung mga companies now. We have this coordination with the companies. So very important po yan kapag may kailangan silang i-isolate, we accommodate them here as well. This is our Santa Rosa Community Isolation Unit, which is very crucial for us to solve this problem pag may nag-positive po. So alam naman natin, ang key is of course wearing mask, physical social distancing, and isolation. No? First of all, hindi lamang yung positive, but yung mag-start pa lang, yung IgM positive natin. At yung may mga symptoms natin. So the Santa Rosa Community Isolation Unit ay nag-house po ng ating probable suspect at saka po yung mga IgM na kinakailangan natin i-check after swabbing ay i-isolate natin. And ito po yung nag-taker doon. Sa Rosa Community Isolation Unit, which is an example of our team. So ito po ang example na together, we can really help each other. Iba-iba pong organizations, iba-iba pong units at institution ay nandito po, tulong-tulong pa na dito. Then this is the complex of Hope, Medical City, South Luzon. Dito po sa Santa Rosa, as well as in other cities as well, Valenzuela and other cities. So alam po na coordinated kami sa ating mga private hospitals. We cannot do this on our own. Tulong-tulong po. In our own Santa Rosa Community Hospital naman, there's a building that we assigned as our COVID hospital sa 16 unit building. At kapag ka po wala nang room doon, then we bring them. Coordinated na kami, the two COVID hospitals namin sa City of Santa Rosa, Polymed, as well as the Medical City, South Luzon. And regularly po, again, because this is a health crisis emergency, we regularly, together with our city health offices, the doctor, our community hospital doctor, and the private hospital doctors, we regularly meet to assess ito pong ating pandemic. And then, of course, because we allotted budget as well for the testing, we're doing targeted testing, not mass testing. We're doing targeted testing. Of course, ano naman yun, it's a given, ating mga medical health workers and frontliners, including PNP, and our birth, and our barangay captains and frontliners natin sa barangay, we're doing the rapid test. Nung nag-open up po tayo, sa City Government of Santa Rosa sa City Hall, we're doing the alternate work schedule dito, even up to now, para po hindi sabay-sabay ito mapasok. So we're doing tests again also for our City Hall government employees. And then right now, level 3 na po yung aming gene expert lab na ginagawa, and hopefully by next week we can open it up and we get the license from DOH. Para aside from the rapid test, we'll be doing PCR lab already. PCR testing already. Yeah, so parati ko po sinasabi, mas magandang may tinanim. Kung may tinanim kami aanihin, ibig sabihin po, because I think we've been helping even our locators here. The City of Santa Rosa is very lucky to be receiving donations from these companies But then again, most of our donations we give to our frontliners, and what we really give to our households, our families, the city plan and purchase them as well. So these are our donations and all. Again, this is a socio-economic, but then initially it's really a health crisis, health problem. So we are doing everything. We're doing everything, checking our budget, prioritizing our budget. Now the priority is the health of the people, how we can help the people have something to eat. So if we set aside the others that we think are not needed at this moment, and we will prioritize the health of the people in the city of Santa Rosa. And because we have always promoted participatory governance, we make the people first of all understand, and we make them have a say in how we combat this pandemic, and that is by giving them the role of again monitoring to birth. Our barangays have been very helpful. We give them the primary role of monitoring, and then the other industries were very helpful. How? Why? Because we also promote helping them. Most of the companies, the city of Santa Rosa houses manufacturing industries, export-oriented industries. Kaya from the start, 50% of our industries are open. Pero that time, hindi kumakalat, wala kami masyadong cases. Why? Because from the start, ay coordinated po kami. Ano gagawin nila sa mga empleyadong magpa-positive the city? We turn it over to the city government. So natutulungan po kami dito. Why? Because sabi nga po natin, if the people are affected, then lalong dadami po ang kaso ng ating pandemya, ng ating COVID-19. So even up to now, even from other cities na nandun po ang mga industriya, mga kumpanya, still the directive of the city of Santa Rosa is for you to tell us sino ang affected, especially from our city. Kasi upon our own assessment, kapag hindi po natin ginawa contact tracing from the person to the family, lalo po ito kakalat. So we're very strict on contact tracing sa positive at sa pamilya nito. We do tests sa family. We don't just allow them to do home quarantine or to isolate themselves. We test them. Para sa ganoon, yung local transmission po ay prevent natin. Again, sabi ko nga po, this is both a socio-economic and most especially a health crisis. That's why simultaneously and parallel to what we're doing to help the people have something to eat, we're also doing something. No? And we're very OC on how we take care of them physically and how we can take care of them para po health-wise, para po hindi kumalat ang pandemic. I'm just so sad that our numbers nag-decrease na po sana. Kumbaga, what they say, we flattened the curve already, but then again, nag-increase po. Why? Again, I always feel relaxed, no? In dealing with the people. I should, first of all, sabi nga, the mayor should be the one na makita na may pag-asa, no? May pag-asa tayong lahat. So I always say, that's why I always assess, no? Kapag may ganung kaso, and we're very transparent, we always do announcements, which is very important now. More than anything, we wanted the people to be assured na everything will be okay. We're with them, no? And we're taking care of them. No? So what I wanted to say is that sa pandemic na ito, we know that they recover, they become cleared, and we are one with them, taking care of them. So again, as I always say, participatory governance is very important. We can take care of you, but then you have to let us take care of you. So that's how we do it. This is very personal po ang treatment namin ito. And again, kapag may tinanim, may aanihan. That is in terms of how we use our budget, no? How we use our income, and then how we relate to our industry partners, to our locators. Na realize ko po na again, because we've been taking care of them, they also, kung ano man po yung may tutulong nila, they take care of us as well. And in this pandemic, we can really say, we heal as one. Kaya kinakailangan ko ng tulong ng bawat isa. And I need the people realize that. Kaya po, we were able to, not silently, but as one, I think we are able to address this pandemic.
Thank you very much, Mayor Arlene Arcillas, for sharing a very comprehensive sharing of your experience in responding to the pandemic. But just would like to mention that I took note of your assistance in terms of food, financial assistance, and enforcement. I like the enforcement because it really shows that Santa Rosa is really monitoring what it is providing to the community, to the people. And also, I would like to mention about your healthcare system, because according to international organizations, we should be ready. Health system should be ready to respond to pandemic. And that's why these organizations are worried for developing countries because of how they're going to respond to the pandemic, because the health system is not yet ready, okay? Also, you mentioned about the personal approach, which is very important. Your budgeting system, because you have not really used your 20% development fund. And this is something that Santa Rosa City should be very proud of. And with that po, before we will have, I'd like to inform everyone that the open forum will be after the presentation of the next equally accomplished mayor. And now I would like to introduce the next guest speaker. Our next speaker is on his third term as the Chief Executive of the City of Valenzuela. Valenzuelanos felt the remarkable improvements in their lives. The solid foundation of his public service is underscored by his governance platform known as the 5 pillars of good governance. This focus on the essential needs of every Valenzuelano in education, health and social welfare services, housing, economic development, and livability. Under his leadership, Valenzuela City has earned over 100 awards and recognitions for his innovations in good governance. Let me cite you some of these examples. Hall of Fame awardee as the most business-friendly, highly urbanized city, Seal of Good Local Governance, the Seal of Child-Friendly Local Governance, 3 consecutive annual Seal of Good Education Governance, from the year 2017 to present, Age-Friendly City Award, Excellence in Kalusugang Pangkalahatan Award, and they have an international award, the Guangzhou International Award for Urban Innovation, 30 Deserving Cities citation. These are the affirmation of the city's economic accountability, disaster preparedness, outstanding employment, and micro entrepreneurship development programs. Timely health and social protection policies, sound implementation of peace and order advocacies, and commitment in making Valenzuela City a truly livable city. As a result, the city of Valenzuela has become well-known in the field of governance excellence, not just across the country, but also in other parts of the world. Ladies and gentlemen, a pioneer in delivering disruptive innovations in public governance, the father of the city of Valenzuela, Honorable Mayor Rex Gatchalian. Good afternoon po.
Good afternoon. First of all, thank you for having me. Professor Bello and the rest of the faculty and the men and women behind this webinar, thank you for having me. Of course, I'd like to say hello and greet my good friend, Mayor Arlene. Magkalayo kami, dulo-dulo ng Metro Manila. I'm in the north and she's in the south, but we always see each other in good governance forums and in pushing for good governance initiatives. Now, I have a brief presentation of the journey of Valenzuela in managing the pandemic. But before I go with that slide, I just want to give you an outline. Right after this short presentation, we're going to play a video that will show naman what we've been doing in terms of adapting to the new normal. I know that it's still very important to discuss what we've done and how we're still coping with the pandemic. But as the economy opens up, as business goes back to life, we also have to discuss how Valenzuela or cities like Valenzuela, who has a very big industrial base, will have to adapt and adjust to the new normal. Now, first off, if I can move to the next slide. If we can move to the next slide. Yep. So basically, in a nutshell, what were the challenges that the local government of Valenzuela faced during those ECQ days? First of all, the lack of a national ID system or a household database. Remember, initially, Valenzuela wanted to launch its own localized ID system, but we put that on hold because we believe that we thought that the national government's ID system will come into play. Now, unfortunately, I think it's taking time to launch the ID system of the national government. And this was a challenge to us because when the lockdown happened or the ECQ happened, we were told to feed our constituents. That was the basic. And in targeting that, we had to look for the poor, nearest of the poor, and poorest of the poor constituents. They're the most vulnerable. In Valenzuela, we launched, like Santa Rosa, we launched multiple waves of food aid, but to target our close to 240,000 families. But for the first wave, because we were running against time, we wanted to target first the poor, nearest of the poor, and poorest of the poor. And it was a challenge because we didn't have an ID system at that point. But for the second and third wave of food packs, it was now universal. Every single Valenzuelano got food packs. Now, moving on, another problem that we encountered was the seemingly incongruence between what the DOH was saying publicly or nationally and what was happening on the ground. Case in point was the testing. The DOH was saying that they've already revved up their testing capacity. So a lot of people, because they were anxious, wanted to get tested. But on the ground, there was an issue on the testing. We all know that. Parang iba yung nasasabi ng Department of Health nationally, iba yung nangyayari locally. And the incongruence was causing so much anxiety or build up, emotional build up sa constituents, especially when they're seeing that loved ones are getting sick and they wanted to get tested. Third challenge was, unfortunately, we felt that there was a lack of Department of Health guidelines when it came to putting up isolation facilities, protocols in treating symptomatic and asymptomatic patients. At this point, we all know that it's a pandemic, but given that it's a health emergency, we were relying on the national agency, the lead national agency, which was the Department of Health, to provide the guidelines. But at that time, we also felt that there was sort of a lag between what was happening and how Department of Health was issuing their guidelines. Now, if we move to the next slide. Can we move on to the next slide? Now, what did we do? What did we do to address these issues? Like what Mayor Arlene said, at the end of the day, kami sa local government, we can't keep on saying, kasi walang guidelines, walang guidelines. We had to take the bull by its horn and run the city and find solutions on our own. First off, we didn't have a national ID system. We didn't have a local ID system. How could we target the poorest of the poor families in Valenzuela City for our first round of food packs? What we did was we used our CBMS data. That's something that we religiously do in Valenzuela. Keep our CBMS data up to date. We also have socio-economic maps, zoning maps, and actual census by our barangay officials. So we put all of these together, we layered them on top of each other, and we figured out where the near poor, poorest of the poor, or the poor families live. So thereby we were able to target our first round of food packs to those that needed it the most. Now, part two, how did we, because of the incongruence, no? Department of Health seems to have had challenges in contact tracing, in setting up of isolation facilities, most especially in testing. we couldn't keep on saying na wala kasi, nag-aantay pa kami sa Department of Health. Local government units had to find ways. And Valenzuela is proud of the model that we pursued. At that point, it was close to Easter, and people were all sending their test results or their test samples to DOH. It was taking time for DOH to return the samples. So you can imagine, we wanted to test, we were testing, sending the results, but the lag was too much. At one point, the lag was 2 weeks to 3 weeks before you could get your results. Valenzuela figured out that we have to find a parallel path. We can't keep on using government capacity in testing because it was already loaded. Kumbaga, that highway was my bottleneck na. Valenzuela realized that there are existing private sector initiatives out there, and all we had to do was tap into that. That's why we're kind of proud of saying that we were the first to initiate a PPP with local local labs to come up with a parallel initiative for testing. At that point, we signed the memorandum of agreement with the medical city. We bought our own kits from the FDA list. We partnered up with a private lab that was approved by the FDA, which was the medical city at that time. And then up to this day, we're using our private labs. We have 4 private partner labs doing an average of 200 to 250 PCR tests daily. These are locally bought kits, partnered up with local labs, and they're doing the processing for us. We run an average, like I said, of 200 to 250 samples a day, and it's helping us keep a tab of what's happening out there. So we test, we isolate them, and the bottom line there is there are existing capacities or efficiencies in the private sector. All the public sector has to do, or the local governments have to do, is to forge linkages with the private sector in trying to come up with PPP for medical purposes. Again, because we had the data, because we were one of the first LGUs running localized testing. We were doing it already as early as Easter or Black Saturday. At this point in time, as we speak, we're nearing 8,000 swab tests with results done by our private labs. So we have a whole wealth of data. And with that data, we were mining it. We were using it to come up with our own protocols because there's a lack of protocols with the national government or the Department of Health, to be specific. And we were doing it on our own. With the wealth of data that we had, we could mine it and come up with our own localized protocols and initiate it in the city. Now, moving on to the next slide. Now, what did we learn from this whole exercise? It's very imperative that we come up with our localized databases for households. So we're going to jumpstart again our Pamilyang Valenzuelano family cards. This will institutionalize the count of families in the city. Remember, Valenzuela is an industrial hub. We have close to 4,000 factories like Santa Rosa. People will migrate to us for jobs, and they tend to stay. In the city. So we have to keep on running our own local database while waiting for the national ID system to come out. More importantly, what did we learn? Capacities can be found in the private sector. It's imperative for local government units to open its eyes, to understand that efficiencies are already out there, and it's not limited to the public sector. All you have to do is forge PPPs with them, whether it's for testing, running of isolation units like what Santa Rosa did, all the way to coming up with databases or ID systems. All you have to do is be open to public-private partnerships so that you can use finite resources to expand services offered. Now, as I mentioned a while ago, this is actually my last slide. The next slide, the next presentation is what we will do with the new normal. This video will capture what we've been doing and what we intend to do. So if you could play the video before I discuss it. And there's a video presentation that we can stream.
Oh! Akala ko mababayaran mo yung amilya sa City Hall.
Tapos na po.
Eh, yung marriage certificate, birth certificate.
Tapos na po.
Eh di ba, mag-a-apply ka pa ng business permit.
Tapos na po. 10 seconds lang po yun.
10 seconds?
May paspas permit sa Valenzuela. Online permit system. Wala nang hintay-hintay.
Eh, yung pinapalaba ko sa'yo.
Hindi pa po tapos?
Thank you. So, Valenzuela has been automating a lot of our business processes. And late last year, we decided to go online for efficiencies. We decided that when you apply for business permit, when you pay for your real property tax, when you want to get your marriage contracts through the local civil registry, or when you want to do your building permits, you don't have to come to City Hall anymore. You can actually transact online. That's why we launched Paspas Permit. As far as we know, Paspas Permit is one of its kind in the country right now. It's end-to-end, meaning virtually from assessment all the way to settlement, you can do it online. Ang credo nga namin dito sa Valenzuela, don't fall in line, go in online. Now, when we launched Paspas Permit late last year, we wanted it to be more of efficiencies. We felt that at that time, the traffic situation was getting bad and we wanted people to actually be more efficient. Huwag ka na pumunta sa City Hall. Sa bahay ka na lahat. 10 seconds to get your permit. And then if you actually want a plate, not only do we email you the temporary permit, we also partnered up with Grab Delivery so that they can deliver the plates with you. When it came to settlement, we forged a partnership with PayMaya so that we have more payment options. As far as I know, like I mentioned, this is the only end-to-end business permit system in the country and the fastest of its kind. 10 seconds, you get your permit. Now, it came coincidentally that the new normal dictates that there's no face-to-face interaction. So now more people are using this permit because not for efficiency only, but because of safety. We want our taxpayers to stay at home, especially in this realm of work at home or alternate working environment, alternative working arrangement. So now Paspas Permit is going to be upgraded. We're coming up with Paspas Permit with upgraded modules. It will take number 1, zoning, and number 2, health cards and sanitation permit. We're going to take the end-to-end further from an application of zoning permit all the way to getting your health cards. Now, case in point, Paspas Permit is also one of the only kind in the country where the barangay permit for business permits is already incorporated, meaning you don't have to go to your barangay halls anymore for getting your business barangay permit. You can do it online. So virtually, you don't have to step foot to City Hall, on City Hall. You just go online, transact everything. Bottom line, kung ang private sector na disrupt nila ang shopping because of Shopee and Lazada by going online, or you can book your hotel and plane tickets online, disruption should not be it should not be contained to the realm of the private sector. Disruption can also happen in the public sector, in governance, and that's what we're doing in Valenzuela City. With that, again, maraming salamat, and I return the floor back to the moderator.
Thank you very much, Mayor Gatchalian. There are 3 things that I remembered from the presentation. One is repurposing. He mentioned about the challenges, repurposing meaning the use of the CBMS, which was done, as mentioned by the mayor, it should be updated 3 years ago, and they kept on updating this. This is very important because I think this is the only database at present. There are others that you can use to really respond to those who are really in need. And I call it repurposing because it was done for a different purpose, and now the City of Valenzuela can now use it. One is the partnership. This is very important, that not the government in partnership with the private sector can move mountains. And the other one, which is, I think will be very exciting to all of the local government units, is the automation. I think this is the one that is being looked for and what is needed by the different LGUs so that you don't have to go out. Just by clicking your mouse, using your telephone, you can now have, imagine how many seconds? For those
10.
who are 10, remember, 10 seconds, you can get the business permit or any other application permits that you would like to have. And with that, thank you very much to Mayor Gatchalian and also to Mayor Arlene Arcillas. Now, I'd like to open the floor for open forum. Some they have posted questions, and the first one, I'd just like to read because the audience cannot ask the question, the participants. The first question is, how is the LGU helping the schools? It did not specify whether it's the public, elementary, high school, or tertiary. But the question is, how is the LGU helping the schools? Yun po yung number one question.
Ladies first, kay Mayor Arcillas muna. Tapos kokopya na lang ako.
For na yung pag-visit namin sa LGU mo for that online,
Anytime, Mayor, anytime.
Okay, so initially I said that with the private schools, since alam naman natin diretso yung yung salary and allowances natin ng private school teachers, and then yung programa natin private schools, they asked my help. And we gave them assistance at mga private school teachers and personnel individually, no? And then with the coming school year, we're trying to get the data. Of course, public school tayo, kasi libre paaral dito sa lungsod ng Santa Rosa at all walang gastos yung mga parents, for from kinder to even daycare up to high school, senior high school, So that will be a challenge. Bakit kasi kung online? So we have to provide them with gadgets. Actually, madali yung gadgets, ang mahirap yung connection, yung connection nila. But anyway, we've already started planning kung how many we can provide. Although pinag-provide natin all the students first, we will provide them with the gadget. Na-compute na po namin. Kasi ngayon, the DepEd po kasi ngayon is chine-check kung ilan yung mag-modular at ilan yung mag-online. So, for those who chose online studies, we will provide them with the gadgets, MRU sa kanda, as long as sila ay estudyante natin, they can have those. Of course, as a modular, the city will help as well, providing for the modular, yung mga printing ng materials natin. Napag-usapan na po namin yun ng LSD. And even diretso po, sa private school kasi meron kami libreng paaral sa pribadong paaralan ng mga high school, from grade 7 up, senior high school. Ito po yung mga hindi sa public school natin pumapasok, and we have scholarship for the private schools, diretso po yan, ang scholarship natin diretso. And kung sino scholar namin, we will also provide for the gadgets. Ngayon po, pinapasubmit ko the public schools, what else? Kasi may po yan, may mga guidance silang sinusunod at mga requirements na i-lay down po ang DepEd. So we're trying to get kung ano po yung mga isiset nilang guidelines para matulungan natin ang ating mga schools dito. And even the private schools, we're checking also how many yung enrollees nila and how we can help them. So the city government of Santa Rosa is very willing to help as long as we know kung ano yung mga kailangan, and we can assess kung paano natin sila matutulungan. So all scholarships, tuloy po. And even our college financial assistance natin, yung siya po namin, ay diretso siya. So kung ano man yung pangangailangan, so we'll try to help them as long as isubmit po yung mga report, and then we will assess. That's how we're doing this in Santa Rosa. Actually, yung pinakamahirap po, yung discuss namin ni Mayor kanina, the Mayor Gatchalian yung ayudas, madaling gawin. Actually, dito po kami nahihirapan sa mga students po natin. Paano yung sistema ngayon. Sinabi ko yan sa LSD namin, this is very difficult. But we of course have to follow kung ano pang i-lay down ng DepEd. And then sabi ko sa kanila, we will inject what we know will be good for our students.
Thank you very much, Mayor Arlene. Can we hear from Mayor Gatchalian, please?
Yeah, ako parehas, no? Remember, the challenge here will be, number one, walang face-to-face interaction. So you really have to go digital. The city is already working with the local division. Meron na silang modular learning wherein they'll provide the kits, no, the learning modules that they'll bring house to house. Pero the challenge will be how to administer these kits simultaneously in a uniform format. Remember, madali gumawa ng modules, pero pag hindi naman kaya na magulang i-administer yun, kasi remember, marami sa atin matagal nang walang sa school. Ako man, mahihirapan ako i-administer yun. Mahirapan pa rin sa self-learning. So what we're planning to do will be in exploring the following. Of course, we'll have to give them devices sa mga wala. Pero it's how you administer it in a uniform format. We're looking at either streaming out of a school, the content, parang virtual classrooms yon. We're also looking at a pure online environment like Canvas, which is a readily available tool. You just have to subscribe to it. We're fine-tuning it in the sense that it's more of the administering of those modules that DepEd will be giving. Paano yun maituturo sa bahay? And I understand that DepEd is also coming up with its own plan of using television or radio. But for the local government unit, what we're exploring will be the different platforms, whether it's streaming out of a school, going virtual in a virtual environment like Canvas or yung, I think it's called Blackboard. Now, these are readily available tools. We just have to be creative and do it. Now, the biggest challenge pa rin there is Valenzuela is a fairly big LGU, but malaki rin yung population namin. So ang worry namin dyan is how many of those handheld units can we give? So right now, what we're doing is we really need data. We're doing the surveys one by one to figure out sino yung mga poorest of the poor na mga bata nakakailanganin ng data para hindi naman sila maiwanan. Sorry, nakakailanganin ng mga handheld device para hindi sila maiwanan.
Okay, thank you very much po. There is a next question, but before I read the next question, ang sabi po dito ng isa nating participant is, I'd like to commend both LCEs. Your actions are worth emulating. Kudos from Iloilo province. Galing po ito sa Iloilo. And so for our next question, both LCEs mentioned about the participation of the private sector in responding to pandemic. The question is, what about po the NGOs? How did the NGOs provided assistance in responding to pandemics? The question is from Christian Hubert Milambiling.
Yep. Ako, if I may, we have a standing partnership. We do a lot of work kasi for children welfare, protecting their children even before the pandemic. And we know na this pandemic caused a unique set of problems because people were at home. We were working closely with Bantay Bata even before the pandemic. We were working with UNICEF and we were working with Consuelo Foundation. Now, what we did during the pandemic, of course, they came in with all the relief, but we were also coming up with help modules, no? How to cope when you're at home. It didn't stop, but we had to just get tech support from them. Remember, the LGU has the muscle or the logistical muscle, but ang kulang normally is the content. How do you deal with mental health? How do you deal with domestic violence given lahat sila nasa bahay? We had to rely on our partners like Bantay Bata, Consuelo Foundation, UNICEF, in coming up with stay-at-home modules that our social workers were looking out for. Kasi kami lang naman nakakalabas eh. Remember, the NGOs were also kept to their offices or their homes. So kami, more of the content that we were drawing from our NGO partners.
Thank you very much po. Mayor Arlene, do you have
Yes,
also?
of course. I forgot to mention also the help of the NGOs. At first, syempre, we control na they're going out na tutulong. But then again, marami po na tumulong din. Like kay Mayor Gatchalian, nagbibigay ng mga relief, ng assistance, no? And may mga groups po tayo kasi we have this federation of NGOs na sumasama po, tumutulong din sa ating mga checkpoints kasi ang isang naging problema natin, especially during the ECQ, ang dami nating checkpoints at yung number of manpower po natin. Ay nakukulangan, so I'm very happy that they were helping also. Yung mga patrol NGOs po natin. So thank you very much. Maganda. And most of the NGOs naman po ay nagbibigay ng relief and they just ask permission from us kasi we're trying to control nga eh. No? Pinapayagan naman natin magbigay ng mga tulong. And they're really, most of them are really very excited to help as well. Tinatanong ko saan sila pwedeng tumulong. Mostly are from, also not from Santa Rosa lang, from other areas. Tapos we give them kalimitan yung mga areas natin na alam natin mas kinakailangan pa ng more ideas from them. So we would like to thank our NGOs as well. I cannot mention medyo marami, so we cannot really mention all of them. But thank you very much.
Thank you, Mayor Arcillas. The next question is, I understand that both cities are highly industrialized as well as having a high rate of OFWs. Could you share some strategies you adapted to minimize stoppage of the export-oriented enterprises, as well as accommodating returning OFWs? This question came from Professor Ferdinand Maquito from the College of Public Affairs.
Okay, I'll answer first. Of course, from the start of ECQ, ang nilitaw naman ng DTI at ng IETF is for the export-oriented, not to be closed, sana. Kasama siya di ba? Sa hindi naman talagang totally pina-closed, may 50% siya na workforce that time. Then hindi po yung mga manufacturing. I never supported a stoppage of those industries. Bakit? First of all, in Santa Rosa, the big manufacturing industries ng food are here. No, as well as most of the export-oriented industries ay nandito rin po. No, so I never supported the stoppage of these industries, but then again, we coordinated with them. Kasama po tayo sa nagpaplano almost every day po. We coordinate with LTI, we coordinate with DTI with regards this industries, ano. And at that time, hindi naman po, na-control naman po natin, hindi ito makalat. So, but of course, we told them to do shuttle. We supported their shuttle services. May mga permits yun. Coordinated sa atin kung ilan ang mga pumapasok na workforce nila, yung mga health protocols nila. At sabi ko nga po, kung merong positive man or merong may symptoms sa kanila, ay coordinated na sa atin para hindi po kumakalat yung COVID. So I never really asked them to stop, but then we monitor them. And kasama rin po, sabi ko nga po, lahat po ng industriya natin is coordinated with the city government kung ano yung gagawin nila. And medyo personal din ang approach natin. Talaga po, like yung manager ng LTI, mag-detect the part, diretso po sa inyong likod. And ako naman po, kung may questions sila, to help them with DTI as well. No? And then, with regards to returning OFWs po, no, may guidelines naman sila dyan. Ang IATF, ang PNP. Most of them, kapag ka po, we supported them by kapag ka po merong pwede nang umuwi, like na-isolate sila dito for ilang days, tapos may test na rin sila, ay mismong tayo, may ilan po na tayo na rin mismong kumukuha. Or minsan po kasi yung OWA, sasabihin, the stock is up to Alabang, no? From this area to Alabang. Pag sinabi pong hindi na pwedeng, wala nang maghahatid, no, going to Santa Rosa, ay pinapasundo rin po natin. That's one of the services that we gave to the returning OFWs. Pagka po sinabi sa amin na kailangan pa mag-isolate, may ilan po tayo na ginay din natin how to isolate. Meron pong ilan din personally ay tinulungan na natin to get a hotel and we can help them here in Santa Rosa to do that. But we never, I'm so sorry, but we never really allowed, kasi may mga nagpaalam, we never allowed na yung ano namin, yung facility namin, yung private mga hotels natin to be used by OFWs na yun ang magiging stop na hindi taga Santa Rosa. Kasi during the start of ECQ, I asked the hotels natin dito if they will allow na sila yung maging in-house ng mga industriyang open sa atin. So, ginamit po namin yun. No? Of course, proper health protocols, ay ginamit natin yan to help the industries na mailapit sa kanila kasi ayaw natin man pauwiin, di ba? Ang mga employees. So, yung mga hotels dito, yun po ang pinaka-coordinate ko with the industries na open or companies na open at doon po nila hinaus yung mga employees nila. So, with regards to OFW, ngayon po may mga reports sa amin na merong ilan kami, kasi coordinated naman tayo sa OWA, may I think 15 or less kami, and I told the Arteso head, Perla Losada, na we will give assistance to them. Ngayon po, minamonitor namin sino-sino yung mga OFWs na hindi pa makakabalik kaagad, and isa yan sa mga bibigyan natin ng economic stimulus package natin, na nireservahan na rin po natin as part of our financial health.
Sa side ng Valenzuela, I always believe na the efficiency that we have already or the capacity that we have already, the private sector can use that also. Remember, I keep on going back to testing. in the case of Singapore, for instance, the second wave ng infection nila took place in the ranks of the workers. Kanila nga, more particularly their migrant workers, kasi hindi yun na-test ng maayos. In Valenzuela, the ones that we kept open, the industries that we kept open, we promised them that the moment meron may mag-test sa kanila ng positive, we will do the contact tracing for them with using our automated app. And at the same time, using our capacity to test. Kasi at the end of the day, you want the factories to remain open, but you want to isolate those the individuals who are testing positive. So even up to now, we have a close relationship with the Human Resources Group of Valenzuela. These are representatives ng mga factories. And the moment na may test ng positive dyan, there's massive information sharing. Meaning they tell us the shifting, we do the contact tracing for them, and we do the testing, and we do the isolating. The only way kasi we can insulate the factories from further economic damage is they remain open. And for them to remain open, we have to manage the risk. And part of managing the risk will be testing and isolating. And to some degree, we're proud of our localized testing. We're doing massive testing at 200, 250 a day. Alam ko kulang pa, pero it's probably one of the bigger capacities in the country right now. Now, for coming back OFWs, we wanted to be part of the solution at that time. So we forged an agreement with IATF and OWA na pag taga Valenzuela, we were picking them up from the airport already and the isolation unit, and we were doing our own isolation. And we took them in, cargo na namin yon. We didn't want to pass it on anymore to OWA, and we did our testing again, our local testing. Kasi mas mabilis yung amin to some degree dahil the private labs were returning the test exams at 2 to 3 days lang. So we bring them home, we isolate them, and we test them. We didn't want to be parang we wanted to be part of the solution and reduce the load ng OWA. Alam namin, hundreds and hundreds of thousands of OFWs are coming home. So maski pa paano man lang, makuha na namin yung amin, kami na mag-isolate, kami na mag-test. Now, going back to PPP, right now we're working with a micro-lending facility that specializes in helping out through working capital. They're doing the risk assessment kasi marami sa mga bumalik na OFWs are now venturing in as entrepreneurs. And the only way we can help them is more access to working capital through private financial institutions. There's many out there. We just have to explore and provide the necessary framework for them to succeed.
Thank you very much. Here's another question. In fact, we're getting so many questions from the participants. This one is, I congratulate the two local chief executives for the strategies they employed in managing impacts of COVID-19 pandemic. My question is, do these highly industrial cities have programs of providing assistance to local government units that are IRA dependent? So ano daw po ang assistance na binibigay ng dalawang cities to LGUs who are IRA or IRA dependent?
I'll just have to be very honest. All our resources are already strained out. And in as much as Valenzuela wants to help out more, we have to use what limited resources we have for our people first. These are the times that we want to share, but there's just not a whole lot to go around with when it comes to COVID. Remember, na-move rin yung tax season ng LGUs, kaya we don't have a lot in our coffers. Not to sound very inward-looking, but marami rin kaming problema that we have to finance, and I have to be honest that kulang na rin yung hawak namin.
Okay, on my part, again, like kay Mayor Gatchalian po, no? Whatever I help the other LGUs with, ay hindi ko po kinukuha ngayon sa budget, no? Sa finances or sa pera ng city government. But I do help kasi sabi ko nga po kanina na-mention ko, di ba, sa mga donations ko. Yung donations, yes, I give them to the health workers, I give them to the barangays, but then again, pag may sobra po, yun yung binibigay ko kapag kami simulan po LGU. Like, if I may mention, no?
Mayora, susulat na ako sa inyo.
Personal sa akin, no? Ako pa mag-prepare, no? Like San Miguel are donating to us 46,000 chicken, and now 500 and almost close to mga 700 kabas ng bigas, no? Sinabi ko kanina, we already planned, yung ipapamigay. So for me, papamigay ko doon sa mga households natin, ito yung binadget talaga natin. no? The chickens, the rice, the vegetables, ano? Kapag ka po may dinonate sa amin, so hindi ko yun kalimitan sinasama. Kung sa i-distribute ko per household, per family. No? Kasi talagang may budget naman for them. Ang ginagawa ko po, like I asked the donors, like San Miguel, sinasabi naman nila, it's your mayor kung kanina mo yung ibigay. So pag may sobra po, I give them to other areas. May mga barangay po from other cities, may po ng tulong. Personal po, na yung choice ko kung saan kukunin, and yun po yung mga donations sa amin ng ibang industries na sinasabi ko rin naman po, ito ay bigay ng ganitong company sa ito. So para mas spread din po yung tulong ng ating mga mga companies. I used to have, before it was mentioned also that I was congressman of First District of Laguna, which covered San Pedro and Santa Rosa. So sabi ko nga, Santa Rosa, I've already budgeted, but I will give them. No, at sobra-sobra pa naman din po yung naibibigay natin. No, hindi naman sila magre-reklamo. Pero minsan, pinapaalam ko, I'll be giving San Pedro, sa barangay sa San Pedro, which I did already. Pero yun po ay hindi ko kinukuha sa dapat ay sa taga Santa Rosa na budget. Personal po yon from my foundation. Of course, I wanted to help them as well because they used to be my district. So may ilan pa pong mga towns, no, especially in Laguna and some barangays sa like in Batangas po na we're set to help. Pero again, like near Gatchalian, because we know that our constituents should be the priority. We don't get it from the budget ng city. Whatever I help the other LGUs with, personal po yon at sa mga ibang industriya na nagbibigay ng tulong like even medicines po, yung mga pharma natin dito, maraming binibigay ay sinishare po natin sa iba.
If I can just add though, looking forward, and I'm sure kay Mayor Arlene ganito rin, we're building our own lab. We're almost done. We're 30 days away. And we know for a fact that that lab will have excess capacity. The lab is for testing. And we all know this is it all starts with testing. So we're ready to open that lab for other LGUs around Valenzuela, especially yung mga nasa southern Bulacan, which is neighbor ng Valenzuela. I'm sure yung lab rin ni Mayor Arcillas, mauuna lang siya kasi mas advanced siya eh. Again, I think the lab of Valenzuela is opening 30 days to 45 days off, and we can readily use the excess capacity for the other LGUs to test.
This next comment is very timely. It says here, from Eugene Puente, the health system response of Santa Rosa is commendable. Strategic yung location ng lahat ng unit. From the triage to isolation to monitoring, sobrang ideal ang positioning. Salute to the Honorable LCEs, Arcillas and Gatchalian for being proactive despite the incongruence of DOH. Now, my question po is na medyo hindi related. Ang tanong dito ay, what is your stand as regards Balik Probinsya program? How do you address conflicts that arise? So yung pong Balik Probinsya program, ano daw po ang masasabi niyo doon?
Siguro magkaiba kami ni Mayor Arlene in the sense na magkaiba yung geography namin. Diba right now, it seems sa mga news article, na nanggaling sa mga LSI na natrap sa Metro Manila at pinabalik sa probinsya yung spread sa Cebu and sa Eastern Visayas. So kami, we're more of, pangit man pakinggan, baka kami yung culprit to the problem in the province. So kami here, DILG has already instructed the withholding of issuance of travel authorities, travel passes for certain regions, and we're abiding by that. Pero kami, we always want to reduce the problem naman ng probinsya. Alam namin may mga residente rin kami na gusto nang bumalik sa Valenzuela. And lagi namin sinasabi, we're not gonna bar you from coming in. Balik kayo dito, we isolate you, we test you, 2 to 3 days. If you're negative, we bring you home. Siguro yun ang maitutulong namin. Mabawas yung mga residente namin sa nahawak nila para makauwi na sila sa amin.
I think we're similar as well, Mayor Gatchalian, kasi marami kasi dito, di ba, yung mga transients na. And workers, because we have so many factories, we have so many industries, tsaka yung work dito is napakarami. Ganun din. Baka kami rin yung nakakadagdag doon. But then again, syempre, nung before naman, sinabi na pwede, and then we give them permits, we make it easier for them. para sa akin kasi kung gusto umuwi dun kung saan talaga sila nandoon is they're right, diba? They're right. But then we help them as well. We make sure that they're may medical certificate bago natin ipadala. Most of the time then, we coordinate with the LGUs. And similarly, pag may pupunta po dito, uuwi dito, ganun din naman ang ginagawa. No? And we're very open, of course. Ang sinasabi ko dun sa mga tao, at first kasi mga barangays ayaw, di ba, na may uuwi. Sabi ko, ano magagawa natin? First of all, it's very inhumane na hindi natin sila pwedeng sa sarili nilang tahanan. Di ba? So we help them. May mga pinapasundo pa nga ako from Pampanga, from Bicol, na pag mayor gusto na namin umuwi dyan, especially locally stranded, di ba? Pinapayagan natin. But of course, we follow the protocol na hindi mo na mag-14-day quarantine, hindi mo na pupunta sa pamilya, we isolate them. Yung iba, pwede pumunta sa pamilya, umuwi sa bahay, pag willing naman yung family, kasi hindi pa lang 14-day quarantine, hindi sila magka-quarantine. But because we have the rapid test na ngayon, and we're promoting that, we do that. No? Hindi naman natin sila ibabalik sa pamilya nila na hindi natin sila naisaayos, na alam natin na may possibility of makapag-infect sila. And similarly, ganun din naman po sa ibang lugar. For me, we make them, the other LGUs, hindi namin pinapayagan actually kapag walang acceptance ng LGU. Diba, Mayor? That's the procedure kasi dapat may acceptance. Kaya pinapoint out namin sa kanila pag kukuha ng travel pass, ng permit, certification, coordinated na ba to doon sa LGU, and nagpapadala naman ng copy. Minsan yung LGU, most of the time yung LGU, kung i-accept nila, then we support them. May ilan na po ako, pinamasahin na natin going to Cebu, kung ano. Kasi kompleto naman yung dokumento, they were tested, they were cleared, at sabi naman ng LGU, kung tatanggapin nila, so we allow them. For me, it's not, Pero ngayon, siguro, because ang nangyayari is, nagkakaroon ng medyo sa protocol, na sasabihin nag-negative, tapos positive doon, I think we just have to help each other, in helping our constituents as well as the constituents of other LGUs.
Thank you very much, Paul, for your answers. Another question. Actually, we have so many questions. Good afternoon for both mayors. What can you suggest for LGUs to address the internet connectivity of far-flung hinterland barangays? So ano daw po ang nyo?
Well,
Suggestion
ako wala lang kaming hinterland, pero kahit sa Metro Manila, problema naman ng connectivity. Before the pandemic, we were working with a third player, yung Converge, about putting in fiber optics in the city. They've already done the fiber optic lines. We just have to activate the Wi-Fi nodes and the active components. But other than that, I really believe this is a national government problem that they have to start regulating the internet speed. The LGUs cannot by themselves do it. We need national government support, especially since we're going digital with everything. Bandwidth has to improve.
Yes, we have the same problem. Actually, binanggit ko nga kanina, we can easily provide magastos lang for gadget like tablet or netbook for every student, laptop for every teacher, no? Yung connection, the connection ng medyo problema. Again, parang hindi Gatchalian, ngayon pa lang natin sinasaayos yung ating their connectivity. Of course, we're very crucial yung role ngayon ng ICT. But then parang we're trying to get meron kasi na USB, yun ang one of the procedure yata USB ang gagamitin. And then my brother who's an IT expert, may sinasabi siya na pwedeng yung parang cell card, parang meron yung time lang, may limit lang na per month, parang hindi not as mag-gastos kapag provide na natin sila ng ng connection, the whole time. Na ito ay parang yung limit yung gas, yung use nila dito during their hours na nag-lesson every inaplano kung ilang hours per day yung kinakailangan nila na connected sila or something. No? So actually that's the hardest. So we can give things that we can buy, we can give, pero ito yung medyo mahirap na syempre yung pati yung sa teachers, di ba? Teachers na sa bahay ng teacher, bahay ng estudyante, kailangan talagang may interconnection. So we're still doing that. And at this point, sabi nga po ni Mayor Gatchalian, this yung national government is very crucial, especially in the ICT po ngayon, has a very special and a very important role kapag talaga pong online, no? Itong gagawin natin.
Okay, thank you very much po. Talagang yung connectivity, ang problema ng bawat isa, hindi natin maiiwasan na magkaroon ng glitch. Even if we really worked hard na talaga maging maayos, lalo itong webinar series, minsan nagkakaroon po ng glitch. There is a question po addressed to Mayor Gatchalian. Weren't you worried that these permits sent online may be forged or altered? So baka po daw may mga
two things. Number one, they're okay. First of all, the temporary permits have QR codes to it with embedded security features. We have a third-party vendor helping us with the embedded QR codes. Number two, there's always a post-audit. Remember, in the new ease of doing business, which was patterned after our streamlining process, we can give you the temporary permit. Pero in 30 days time, you have to submit all regulatory requirements and we do the inspection within 30 days. So mahuhuli ka rin namin at mahuhuli ka rin namin. We will still inspect you. Pero the important part is, lalo na ngayon, you get to start your business ahead of time. Saka na yung to follow na lang, hindi namin wini-waive yung mga other regulatory requirements. It's provided by law naman. It still will be inspected. And the QR codes really help.
Okay, thank you very much. A related question po is, Paspas permit in 10 seconds. Wow, how did you do it or make it? How did you make it happen? How much did it cost, more or less, in putting up one, Mayor Gatchalian?
It didn't happen overnight. Over the past couple of years, you have to first automate whatever's inside City Hall. And number two, you have to streamline your processes as well. You can't go online without streamlining the processes in City Hall. Magkakaroon yan ng disconnect sa isa't isa. So over the years, we've been slowly doing it. And then late last year, nung nakompleto na namin yung full automation ng City Hall, we went online. It's just a matter of putting the digital version online naman. How much did we spend cumulatively? Not a whole lot of money. Over the years, siguro we've spent close to around 5 million. But that's over the years, no? From the back end to the front end. But the important, crucial part there is you can do it modular. You don't have to do it all at the same time. Kami lang, we did it all at the same time because over the years, like I said, we've been slowly planting, or if you put a piggyback, yung alkansya, piggyback, we were slowly putting in modules one by one over the years. Kaya nasabay-sabay namin late last year.
Thank you very much po. For the past 20 years, ito po nabanggit kanina ni Mayor Arcillas, the world had experienced 3 public health emergencies concerns with SARS, MERS-CoV, and this COVID. Hindi sa pinagdadasal, but I guess we need to get ready for future unforeseen pandemic. So how will your LGU prepare for this to further be efficient and attractive in responding to such incidents? So hindi naman daw po ipinagdadasal na magkaroon pang susunod, but how are the LGUs preparing for this pandemic po?
Yeah. So I mentioned kanina, no? And this, I guess, di ba 100 years ago, the Spanish flu, no? And we're still doing the same. We're still doing the same protocols, wearing of masks, which is very important, and then social distancing. With this, what I'm trying to do, sabi ko nga po, is we assess, personal kasi yung approach, together with my doctors, we assess each positive, yung profile niya, yung ginagawa ng inilingkod, and very crucial, I think, and very important. Napansin ko lang na of course, we're all waiting for the vaccine, di ba? Pero still yung what we've given our constituents, yung flu vaccine, Mayor, at yung pneumococcal, I'm trying to assess kung ano yung niya, importance talaga. Chine-check ko yung inyong likod, yun bang mga nag-positive sa amin, yun bang nag-expire, if they have this vaccines, So again, what I'm saying is very important yung vaccine, and very important also to understand the virus, diba? What's scary here is that, of course, may nag-expire na hindi na hindi sasabihin na vulnerable, di ba? May bata, may newborn kami na papagaling, tapos merong senior citizen. Marami kaming rate of recovery na senior citizens, pero mga middle age tayo na sinasabi natin na supposedly hindi vulnerable, pero nag-expire. So, checking, ano ba yan? Meron ba yung flu vaccine or pneumococcal vaccine, So, again, it's very difficult for us to be the one to assess and then prepare, but we're doing those things for us to also assess kung paano namin ito i-address. We cannot, looking forward, we're also, still it's the vaccine that we wanted, that we need to cope with this, because parati ko po sinasabi, again, for the people to understand and accept this virus and to make them aware na it's there. I always say sa kanila na this is virus, nandito yan. Hindi yan aalis. Hindi na yan, for me, I'm so sorry, for me, hindi na yan, it's there parang flu, di ba? It's there already. So, we have to learn how to combat it first sa katawan natin. So, we're promoting, of course, yung cleanliness, we're promoting yung mga health protocols natin. So, and we've already prepared, yung sa new normal natin. Una-una, kasama sa binadget at pinananapan natin ng budget at pinprioritize natin, yung kinapacitate natin at binigyan natin ng mga equipments, na-purchase tayo, yung ating mga hospitals, very crucial. Is that because, it is because gusto natin gumaling, mapagaling. Ang purpose naman namin sinasabi na hindi natin may iwasan, may mahawa. Especially, but ang pinaka-importante gawin natin, na-mention ni Mayor kanina, especially now that we're on GCQ, tapos mag-end, actually mag-MGCQ, opening industries, is hindi natin may iwasan na may magkaroon, pero pwede natin iwasan, na walang grumabe, mag-expire. Ang kailangan, purpose natin ngayon is mapagaling ng mga tao. So, lahat po yan, nakaset na yung hospitals namin. Even, that's why nga important also with private hospitals, kung hindi na kinaya namin dito, ay may agad-agad, which what I'm doing right now. Pag may nag-positive po sa isang kumpanya, not even from Santa Rosa na company, basta taga Santa Rosa City, kukunin namin yan para kami na mag-aalaga dyan. And I think it's working. Madami ang ating rate of infection, ang ating mga positives. Bakit? Because we've opened up and we're doing testing. Right, Mayor? Kung hindi tayo mag-test, walang positive. Pero ang gusto natin, malaman natin kung sino po yung may infection. So, yung mga tao, don't worry na may mga nagpa-positive, tumataas. Ang worry natin is kapag ka nag-expire yung mga positive na to. Pero yun ang iniiwasan namin. And then I guess both of us are very successful. May recoveries ay mataas. Ang purpose natin is pagalingin, alagaan, pagalingin, at matuto na umiwas later on.
In the side of Valenzuela, taking off from what Mayor Arlene said, I guess parehas kami ng track that we're building our own labs. Why? Because these labs are multifunctional naman I hope that we don't get to see another pandemic or another outbreak like this. But these labs, they're not just for COVID. Most of them naman operate in the same premise. PCRs, especially the open-ended ones, like yung mga Biorad brands, can run tests for other viruses. In fact, mga PCR machines have been in existence forever, but hindi lang natin lahat alam dahil hindi natin pinagpapapansin. So I guess the investment of Santa Rosa and Valenzuela in our own labs can be retrofitted for other viruses in the future. In fact, the lab that we're building is not just for COVID, but for other emerging infectious diseases. That's why we bought brands that were open-ended. Like yung PCR namin is a biorod that can run multiple kits, not just a specific kit. Number two, with your own lab, kasi with your own testing, you can draw so much wealth of data. And that's our role to keep a tab on these data. We collate them. Hindi yan yung magte-test ka lang tapos na. I guess like Santa Rosa, we invest in data banking. Kasi with data, you can establish trends. Yes, I understand that there are no viruses that act the same, but there are nuances that you can pick up. There are things that you learn from this pandemic that maybe the future can learn from as long as those databases are intact. So what we're doing is we're storing all the data that we have from our localized testing. Our epidemiologists and our in-house pathologists, they're coming up with their own research papers that will be placed in the database of the city, not just for this pandemic, but for future pandemics. Yes, ulitin ko, no pandemic or no virus acts the same. But the important thing is there's some type of research that you can lean on somehow for future occurrences. And last, alam ko lagi in a case of this one, I learned that it's a medical emergency, but ang kapatid niya naging yung naging socio-economic rin eh. And as I mentioned a while ago, an ID system will really help. Lagi na ngayon na-realize ko kakambal na problema lagi yung socio-economic nung medical emergency. Because when there's a virus, naturally, the word isolation will come into play all the time. And with that, we have to really take into account that lockdowns might happen again. And with that comes the necessary feeding of the population. But in order to do that, you have to have the right tools and the right maps to target specific populations.
Thank you very much. Well, we're down to the last questions because we're running out of time. But related po itong questions na to, kaya pagsabayin ko na po. The first one is, mayors, sana mayors can share what they're doing to ensure that antenatal care and promotion of nutrition continues. The other question is, how do you deal with social and mental health problems of the elderly and the youth who were subjected to the extended community quarantine? So more or less related po sila on the health concerns. So yun po ang last na questions natin.
Well, again, the answer lies with our partnerships with NGOs like Bantay Bata, Consuelo Foundation, UNICEF. Ang problema naman lagi ng LGUs is the content eh. We can muster it, but we don't have the content. So in Valenzuela's case, they're helping us develop modules that our people can implement when it comes to mental health. And to the same degree, nutrition. We're working with the Ateneo Early Childhood Development Center to come up with a revamped feeding program kasi wala nang face-to-face. So we're working on something that's community-based and delivered to the homes.
On the part of the City of Santa Rosa, wala kami pinigyan na programs. Oo. Parang in-adjust lang namin. Like by scheduling siya, yung supposed feeding program namin na dapat March siya, tinuloy namin. Pero iba na yung distributed na lang siya sa household. No, distributed na lang siya, hindi yung mass feeding program natin. And even our vaccinations, everything, by schedule siya sa mga city health offices natin. Wala kaming tinigil na programa during this pandemic. We just adjusted sa tamang protocols na kailangan natin i-lay down. We didn't stop any other programs. And yung sa pag-mention kanina rin ni Mayor Gatchalian, it is true that the lab that we're preparing right now, bakit siya medyo mabilis namin na ipapasaayos to adapt to COVID? Because those are the machines, no? And the people, trained people natin, na gumagawa sa aming TB lab namin, HIV. Supposedly yung sa akin for HIV, Mayor, pero kinonvert natin muna into tapos we're kasi immediate yung ating response dapat sa COVID, and then we'll do another one for HIV naman. So, hindi lang ito na for this purpose. No, ito yung magagamit pa natin sa iba. Ayun ang sinasabi ni Mayor. So again, we didn't stop any programs, especially with regards to health natin. Even our yung sa city vet namin na programa, we just adjusted to how it should be. Dahil meron physical distancing, bawal ang attend.
Doctor, you're on mute. Doctor, you're on mute.
I love you, mayors, because you're emphasizing on the importance of data. I would love you to be my students in one of the classes that we have here at the College of Public Affairs. It's called Data Analysis and Modeling for Public Affairs. We always say it with numbers, because you don't have to look at the sky and you don't have to guess, because you have the data that you can be used for intelligent decision making. So kayo po ay talagang idol namin when it comes to using data. So marami pong salamat, and with that, we'd like to present to you our certificate of appreciation. Can we request Haji to flash the certificate? While he Center for Strategic Planning and Policy Studies, College of Public Affairs and Development, University of the Philippines, Los Baños, presents the Certificate of Appreciation to Honorable Mayor Arlene Arcillas, Mayor of Santa Rosa City, for serving as resource person in the webinar titled Strategies Employed by Leading LGUs in Managing the Impacts of the COVID-19 Pandemic on June 29, 2020, College of Public Affairs and Development, University of the Philippines, Los Baños College, Laguna. Signed, Marilyn Paunlagi, Director, CSPPS, and Rolando T. Bello, Dean of the College of Public Affairs and Development. Another certificate is being presented to Honorable Rex T. Gatchalian, Mayor of Valenzuela City, Metro Manila, for serving as resource person in the webinar entitled Strategies Employed by Leading LGUs, ito po yun, in Managing the Impacts of the COVID-19 Pandemic on June 29, 2020, College of Public Affairs and Development, University of the Philippines, Los Baños College, Laguna. Signed, Marilyn Paunlagi, Director, CSPPS, and Rolando T. Bello, Dean of the College of Public Affairs and Development. Salamat po ng marami sa dalawang mayors who are very passionate, articulate, and action-oriented mayors. Ito po yun yung dalawa. Hindi po yan may... Padadala po namin via courier. Salamat po ng marami. I have been a witness to the progress made by both cities. Alam niyo po, ang city ng Santa Rosa, siya yung nauna talaga on how doing business easy. So yun po ay ginawa ng isa naming estudyante dito sa College of Public Affairs. Talagang ipinakita niya how did Santa Rosa do it, making it easy to have business operating in Santa Rosa. But I would also like to commend Mayor Gatchalian, kasi po nagpunta po ako sa city nyo and nagpunta po kami sa barangay na nire-replicate po niya yung health service facilities na inyong nasa city. We were so amazed that you have been providing separate, talagang specific po yung facilities nyo for children. So, meron kayong age-specific health services. Kaya po, sabi ko nga noon, at that time, that was 3 years ago, sabi ko, ang ganda rin naman ng inyong mga health facilities. Barangay po yung pinuntahan namin, and yun po ang nakita ko na talagang I really witnessed what you have done. So, yung pong Santa Rosa, may mga magagandang ginawa, and also, the city of Valenzuela, at hindi po kami nagkamali sa aming pagpili na kayo po ang aming inaugural guest speakers. But before that po, I'd like to deliver my synthesis. The scale and speed of the response to pandemic of our guest speakers are critical, not only to lessen the spread of the coronavirus, but also vital to accelerate the recovery of their cities. COVID-19 is a wake-up call for us to invest in the health system and social protection and broaden economic opportunities for all. So yun po, na talagang highly commendable ang inyong pong mga ginagawa sa inyong respective cities. And my closing po is, before I forget, I always forget this po, but I would like to thank you very much for accepting our invitation. It is an honor for us to have you in this inaugural webinar. But I also would like to thank Dr. Arlene Mamino who initiated this webinar series. Also po si Dean Bello who really gave us the support, the CSPPS staff, Danica, Karen, Tessa, Maren, Maris, Lenny, Haji, Marie Chris, and also po the ITC staff of the university for their assistance. Thank you very much. And watch out po for our next webinar series, and we'll inform you po of who will be the equally accomplished city and municipal mayors. Ang susunod daw po namin ay 2 generals. Also again, 1 from the north and 1 from the south. Ngayon po ay tawag dito, kami po ay napaka-gender sensitive. Meron po isang babaeng mayor at may isang lalaking mayor. Kaya lang po yung susunod, we cannot help it, but we're going to have 2 generals, pareho pong lalaki. And with that po, salamat po ng marami sa inyong. I'm really awed by the participation, by the response given to us by our mayors. Napaka-exciting po this afternoon. Ang dami po nag-participate, and yun nga pala, last po, for those who would like to get their e-certificate, please email to us. Aansiran po nyo yung aming evaluation sheet before you can get the the e-certificate. Ano po tayo? Palitan po tayo. And with that po, wala na po ba ibang pahabol? Thank you very much. We're overwhelmed po by your participation, attendance po. Salamat po marami.
Maraming salamat. Thank you. Thank you.
Thank you, Mayor.
Thank you. Thank you.
Thank you.
You're there pa.
Hindi po ba si Mayor?
Si Mayor Arlene.
Thank you, Mayor Arlene. Estudyante ko po si Paolo, estudyante ko rin si Mr. Lucino po, estudyante ko rin.